working with neuropathy patients could be one of the most frustrating or most rewarding experiences we can ever have as providers. And I'm saying that taking under consideration that we have seen lots of autoimmune conditions, we've seen mood disorders like anxiety and depression, we've seen so many different conditions, right? When we talk about neuropathy, I always remember those patients that came in, and when I asked them what they tried and what didn't work, some of them just started crying because the experience of ongoing pain that is either sharp or stabbing or the burning sensation, right? It's for some of our patients that could be random. For some of our patients, it will keep them up at night. For some patients that I've talked to, and you might have had the same or similar experience with your patients, I've had patients, older patients, who told me the pain is driving them crazy. They're on the maximum amount of gabapentin. And I'll never forget this one lady that came in. She was such a nice lady, very polite. She used to be an engineer. She came to me. She was retired in her 70s. And she told me, listen, you're my last resort. If you can't help me, then I'm just done because I cannot live with this pain anymore. We had amazing reputation as the detectives in functional medicine, right? In our practice, we had physicians and nurse practitioner and nutritionists and acupuncturists, and we offer this integrative approach. We would really see patients that have been everywhere. They tried everything, and they heard us as sort of like, if you can't figure out your health solutions or you can't figure out your health problems, you should go see these guys, right? So that's how we would get a lot of those clients. So it's a lot of your patients. So think about this. If 50% of the diabetic patients you are currently seeing could develop neuropathy, right? That's what the statistics are showing us. So we want, as healthcare practitioners, we want to understand neuropathy. If we can prevent it, even better. But if they're already suffering, then we want to have tools in our toolbox so we can help them beyond just giving them a pain medication and sending them home, hoping and praying that they would get better. And we know that health doesn't come from more drugs. To stimulate better health, we have to guide the patient to the appropriate strategies to start restoring their health, right? That's what they're coming to see you. That's what they're paying you for. Factor number one that we're going to go into is inflammatory foods and neuropathy. So you can see we're going to talk a lot about inflammation. Inflammation is a key player in nerve damage and neuropathy. We're going to talk a lot about the inflammation and neuroinflammation, all of that stuff. And you can see today I'm wearing my red shirt, kind of matches that inflammation that we're going to talk about, right?
That's right. And I'm wearing apparently the blue shirt. It's a darker blue, but I guess this is representing the anti-inflammatory effects that we're going to be discussing as well.
And that's sort of like the yin and yang of our conversation today, right? The inflammation and the anti-inflammation. So let's go into factor number one, inflammatory food and neuropathy. And we're going to start with a little quiz for you, just to warm you up, right? So which of the following is not true about chronic inflammation? Option number one is chronic inflammation is important for repair of tissues. Option number two is chronic inflammation increases oxidative stress. Option number three, it contributes to cardiovascular diseases. And option number four, it can be measured with levels of CRP, ESR, and interleukin-6. And ESR, just as a reminder, it's erythrocyte sedimentation rate test. Which of the following, I'm going to give you a few seconds to process it and think it, which of the following is not true about chronic inflammation? The correct answer is number one, A. Chronic inflammation, while inflammation is the initial part of our body's response to injury, tissue damage, infection. If you have a patient with prolonged, or what we refer to as chronic inflammation, it could lead to tissue damage, right? And an ongoing inflammation would lead to tissue destruction while the body is trying to heal, which ultimately it just impairs the proper repair process and potentially can cause either scarring or tissue damage instead of restoration. So that's something that's really important to remember when we talk about inflammation. It does increase oxidative stress. It does contribute to cardiovascular disease. And you can measure it as a C-reactive protein, ESR, or even interleukin 6. There's not just one way to measure inflammation. There's different players when it comes to inflammation. We have to remember that clinically. So let's talk a little bit more about inflammation and how does chronic inflammation or even subclinical chronic inflammation can lead to nerve damage. So this is a really interesting picture I wanted to bring to you from an article published in the Journal of Antioxidants just recently, just in 2024. You can see the direct connection between inflammation, neuroinflammation, and nerve damage. So let's start from the bottom. This is where you see direct injury or systemic inflammation, right? So systemic inflammation triggers, and we're going to follow the arrow on the right side, triggers the activation of DAMPs, which are essentially our damaged associated molecular patterns. These, some of the examples are amyloid beta, fibrinogen, right? So there's different types of damage associated molecular patterns. This is done through pattern recognition receptors, which they noted on the top right as PRR. So those are pattern recognition receptors, right? So some of the examples are toll-like receptor 4 or inflammasomes, which we talk a lot in our functional immunology class. So the next step involves, on the top, involves the microglia. And if you remember, if I take you back to biology 101, that for some of us was a long time ago, microglia is an immune cell. And at this point, with the activation of microglia, we already have what we call neuroinflammation, right? And microglia is an immune cell, as I mentioned, which is deeply involved in the maintenance and homeostasis and play a role in both normal repair of nerves and pathological reactions, right? So we typically, what all remember in biology is that microglia is found in the brain, right? In the central nervous system, and helps to fix nerves. But activation of the microglia could lead to a secretion of reactive oxygen species, right? And inflammation. So if we got signals of inflammation, what will happen is the microglia in the brain and in a peripheral nervous system will transduce in the microglia by nuclear factor kappa B, and that will activate the microglia to produce superoxide. Now, superoxide is one of the primary reaction oxygen species. It's a molecule that contains oxygen, and it's highly reactive due to its partially reduced state. Now, we're not going to get into those different mechanisms, so we're doing a very wide, kind of broad overview. But just what I want you to take from this is that if there's systemic inflammation that is prolonged, it will activate the microglia, and it's starting to produce superoxide, which is essentially reactive oxygen species or free radicals, and it starts destroying the tissue, right? That's what we call a state of oxidative stress, right? So in our body, we got two mechanisms that we want to take a look at: antioxidants, which protect our cells, and oxidative stress or reactive oxygen species, right? which could damage our tissues and cells. So both neuroinflammation, the state of having high inflammatory markers, activated microglia, or inflammatory cytokines, and oxidative stress have a significant effect on the neural tissue. It can cause neural death. It can promote neurodegeneration in the peripheral and the central nervous system. The study is called crosstalk between oxidative stress and inflammation caused by nose and air pollution, an implication for neurodegenerative diseases. Now, when it comes to clinical application, if we want to help patients on a deeper level, we must find out what's driving that systemic inflammation, right? There's multiple factors, and some of them we're not going to talk about today, right? Like gut health, environmental factors. There's multiple factors that can cause that, right? We teach you how to identify those. We teach you specific protocols for each chronic condition. Now, the good news is that there's a lot that we can help those patients. We can help guide those patients to change their physiology and function. And diet is one of the things that play a major role in how much inflammation we have in our body. So let's take a look at a visual summary of what's considered a pro-inflammatory and what's considered an anti-inflammatory diet. This is from the Journal of Nutrients. It was published in 2023. So I love this picture because it's a very simple, straightforward way to look at what could trigger inflammation. So overall, a plant-based diet, or even a diet that is high in vegetables, fruits, and whole grains, let's call it Mediterranean diet, we can call it a vegetarian diet, with moderate consumption of legumes and fish, with low consumption of red meat and processed food, is known to have anti-inflammatory effect. Now, on the other side, we have the pro-inflammatory diet, which has high amounts of sugar, red meat, processed meat, different snacks that have maybe processed flour or sugar, right? And then we have low consumption of vegetables and fruits and whole grains. Unfortunately, when we look at the right side, what type of diet comes to mind when we look at these pro-inflammatory diet, right? Can you think about something, one of those diets? If you said the standard American diet, or SAD, you are right. These are the components of the standard American diet. And so many of our patients come to see us every day looking for solutions for their problems. And you might prescribe them a pill, right, for neuropathy. And we don't think about the fact that those patients are going to go home. They're going to take this pill that's supposed to help with pain that is caused by inflammation. They keep eating inflammatory food. They keep eating food that is high in processed chemicals. They eat food high in sugar. They eat very low amount of fruits and vegetables. So they keep flaring up that inflammation, right? And you don't have to be the person that sits with them and explain to them about inflammatory diet, anti-inflammatory diet. It's okay if you don't have the time to do it. I would recommend to have two options. One is you either refer them to a functional nutrition coach. We have lots of functional nutrition coaches that are in our coaching program, or you can even hire somebody. Like in our office, in our practice, we had somebody who was a functional nutritionist, and they would work, the physician, the nurse practitioner, or myself would do a review with a patient, write the strategies, and then we move them along to do the weekly sessions with the functional nutritional coach. So that's another option, right? But it didn't take us typically more than 5 to 10 minutes to explain to patient and say, you're eating inflammatory food. It could flare up your condition. Here's a one-page. You can even copy paste this from the study, put it on a page, give it to the patient, and say, here's what I would want you to start working on to reduce and increase those anti-inflammatory foods. Now, there's a really interesting meta-analysis. They reviewed 17 studies from 2,300 subjects, and they found that individuals that applied these principles through a Mediterranean diet were found to have lower levels of inflammatory biomarkers in their lab tests. such as lower CRP, lower interleukin 6. That's how we help our patients in the long term. And you can read more about the systemic review study called Mediterranean Diet Patterns, Inflammation, and Epithelial Function. It was published in 2014. All of you in our program can download the functional medicine program for your patients, and it has like 7 simple steps. Every week, every 2 weeks, every month, they can take one step. It comes with a recipe. It comes with simple explanation of why are they doing what they're doing, so they understand. So you can go into your practitioner toolbox in our platform, just download it. You can even put your own logo or name on it, and then make it yours and start using it for your patients, right? So that's a really great tool you can use.
And there's so many types of chemicals that are found in our food, our water, our air, our products, our cosmetic products. They're all around us. And what happens is when there is a buildup of these products, it can actually prevent us from healing and that optimal health. And for this discussion, we're going to talk about one specific type of chemical. You may have heard about this. It's bisphenol A, or BPA. And according to a published article from the Journal of Archives of Toxicology, and this was done in 2024, and it was showing that BPA exposure actually impairs and damages nerves, and it happens through several mechanisms. It's going to promote oxidative stress. It can change the expression of several crucial genes and proteins. It's going to increase neuroinflammation and has destructive effects on those neurotransmitters. It can damage the blood-brain barrier function, and then it can lead to neuronal damage and significantly reduce myelination. These are all parts of the factors that lead to exacerbating the pain, continuing to damage the nerves, and causing the chronic inflammation that is occurring in those nerve fibers with our patients. And this is done just by one chemical, and that's BPA. And there's many other chemicals that that can contribute to this as well. And so where we want to talk about with this one specific chemical, the BPA, where is this found, right? So let's do a little quiz to find out exactly where bisphenol A is found. So which are the following sources of exposure that you can get exposure to BPA? 1, food containers and packaging. 2, baby bottles. 3, water bottles. 4, medical and dental equipment. 5, breast milk. 6, all of the answers except for 5. Or 7, all of the answers, or all of the above. We'll give you a few moments to go through these and figure out which one of these are all sources of BPA. The correct answer is going to be number 7. All of these are possible exposures to BPA. It's all of them. And according to a study that was published in 2014 in the International Archives of Occupational Environmental Health, about 75% of mothers' breast milk samples had detectable concentrations of total BPA, causing issues and health issues with the mother, but this can be leading to health issues with the baby as well. And I want to pop up another picture to kind of dive into this a little bit further, and all of these sources a little bit further for you. And this is published in the Journal of Frontiers in Nutrition. In this picture, you can see a few of the sources that we mentioned here, right? They're going to be some of the dietary sources, including the food containers, the packaging, the baby bottles, the water bottles, the lunch boxes, water tanks, microwavable utensils. And then there are non-dietary sources such as electronic equipment, paints, thermal paper, flame retardants that we see right there, medical and dental materials, sports equipment, printing inks, and even DVDs. And then we can even get contaminated through the landfill. We see this in the middle here, through our soil, our air, our water, our food, that can either be directly or indirectly exposed through those aspects. And this can affect the humans through these different exposure routes. So it's really important to understand what environment your patients are in, and you could do this through a intake form, and which will assess if they are at risk for exposures, or you can do this through testing, and we dive into environmental toxicants in further detail in the advanced and clinical functional medicine program, which will go into all of the aspects of environmental medicine, which is really, really important from a functional medicine perspective, because this is often missed, especially in pain management. And oftentimes we do see that environmental toxicants are a major contributing factor for our patients dealing with chronic pain.